Hello, today we're going to discuss our patient Lucy Gray. We'll start with an S bar. The situation here is that Miss Gray, who is now living alone, has lost her partner to cancer just a few weeks ago. These were longtime partners and now she is alone. She's 74 years old, 110 pounds, 5'4", with no known diagnosed allergies. She's had repeated falls about every month. She reports that she is dizzy upon standing, that she has weakness to her bilateral knees. When she feels the dizziness, she will also feel a little anxious and she's fear of falling. This particular emergency room visit, she did have a near fall where she was able to catch herself on the couch, but she did sustain an arm laceration, which required some bandages. So our situation is we've got poor little Lucy that has had repeated ED visits without really any acute findings. The background was as above, that here we are. The only medication that I see that she is taking from her health record is the generic Celebrex 200 milligrams at night, which was prescribed after her right total knee replacement, which was at the age of 65, so 9 years ago. Our assessment is that there really isn't any acute findings as reported from the nurse. I only saw a neurological workup. I did not see a cardiology consult or a consult for therapies given the complaint of weakness in the knees and dizziness. We all know that dizziness can be a neurological condition, but it can also be as a result for some kind of underlying cardiology or cardiac situation that hasn't been addressed or hasn't been found yet. So therefore, my recommendations would be to do that. Now, when we're talking about recommendations, we're going to use the clinical reasoning cycle. And let's see if I can switch this guy around here to show you our clinical reasoning cycle, which is from our textbook. I did utilize this when facilitating my clinical reasoning decisions. So as you can see here, there's describe, contemplate, evaluate, select, describe yet again, synthesize, interpret, discriminate, relate, infer, match, and review. So I started with Lucy's strengths. So I see that she's 74 years old, but she's still mobile. She did present with stable vital signs and she's alert and oriented. Sometimes at that age, you can find a little confusion or where they're not completely alert and oriented. But in this case, she knows where she's at and everything that's going on in her surrounding. Her health concerns are that, yes, she has dizziness. She has weakness in her bilateral knees. And her blood pressure is elevated slightly at 160/88, along with her heart rate at 102. And does appear that she's been having pulse ox in the 90s on room air. When she did come into the emergency department, they did apply 2 liters of oxygen per nasal cannula. So that does ring a concern. It does appear that since losing her partner that she is experiencing grief, loneliness, and her own words, anxiety. The cause for concern is the dizziness. Where is that coming from? Is that psychological or, like as I mentioned before, could it be a cardiac underlying issue? And then of course the repeated ED visits. So when somebody continuously repeats to the emergency department and there isn't acute findings, it kind of rings bells for mental health concerns. Or that whole gut feeling, a patient knows themselves better than anybody else and she feels like something isn't right. And then of course, above all would be her emotional well-being. What additional information is needed? Has she seen a cardiologist? Has there been a cardiac workup? Has she seen a physical therapist, occupational therapist? I feel like that's pretty important. And has she had any kind of services for her mental health concerns? Regardless, whether she's been diagnosed with depression or anything other than that, we know that she's going through the grieving process and that she's lonely. She lives alone. She repeatedly brought up that her partner's children would come to visit and that her neighbor stops by from time to time, but she's busy. So, she's lonely. So I'm going to prioritize my concerns. First and foremost, we need to take a look at her cardiac workup, whether there has been one, and if not, we need to order that consult just to double check with the tachycardia of 102, not necessarily hugely alarming, but it's there, along with a slightly elevated blood pressure and need for oxygen. Then her knees. Her right total knee replacement was 9 years ago. Maybe it's failing. Maybe the left knee needs to take a look at. Can flare and cause issues. We don't want her to fall. Any kind of fall could relate to a head injury or even, any kind of ortho, break a hip, break a knee, whatever could happen. We need a mental health consult. She needs somebody to talk to. She needs to go through the grieving process. She also needs assistance with her mental health concerns. And then her living situation. She's by herself. She made it clear that she enjoys visitors, but they're minimal. So, would there be a better alternative for her rather than living alone? So I'm going to generate some solutions with interventions that can impact these goals here. We want her to feel better and not feel the need to continuously come to the emergency department without any acute injuries. So let's order those consults if they have not happened, or ask the physician to do so. Let's get a cardiac workup. Let's get PT/OT in there, take a peek, make sure that she's functionally safe to be home by herself. And then let's discuss with the patient. Let's say, are you willing to see a psychologist, have some kind of mental health assistance right now during this difficult time? And then let's talk to her about her loneliness. Does she have interest in home health care where someone could stop by and help her? What about senior groups? She needs to be able to spend some time with some folks. Or even at this point, assisted living. She did refer to her home as an old home and that, it's just her. So would it be beneficial for her to sell her home and live in an assisted living where she would have company with other folks that reside there? So as I explained it, the next question was, what referrals would you recommend to Lucy and her healthcare provider, just as I said so. I'm going to take action right away. If she's agreeable to a mental health consult, a psychologist consult, I would get that done while she's in the hospital. They can come to the ED and start speaking with her and discussing options for her, whether it be outpatient. Now in the great days of telemedicine, you can have teledoc appointments with counselors, social workers, even psychiatrists if you need medications prescribed to you. And then we would go from there. I would explain how assisted living can be a great option if that's something that she's willing to do. I really feel that she needs to go through that process and not feel like she's so alone. And hopefully her cardiac workup comes back non-acute. I would not want her to have any kind of cardiac issue, but if it does, then those need to be addressed as well and help eliminate the dizzy spells and cover all our bases. So that would be my recommendation. Thanks, guys.